Hey, hello everyone. Welcome to yet another Two Talk with Your Dentist on thedentaire.com. I'm Dr. Rekha, and the Two Talk with Your Dentist is an initiative to increase oral and dental health awareness among people. Visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, Telegram, and on LinkedIn. And in conversation with me today on the Two Talk, I have Dr. Gargi S Murthy. To give you a brief introduction about Dr. Gargi, Dr. Gargi Murthy is a practicing pediatric dentist at Bangalore. She is currently the head of the Department of Pediatric and Preventive Dentistry, Diamond College of Dental Sciences, Bangalore. She graduated from the VS Dental College, Bangalore, and secured a 15th rank in her postgraduate entrance examination held by the Rajiv Gandhi University in the year 2004. She is a fifth rank holder in her post-graduation MDS examination held by the Rajiv Gandhi University in the year 2007. Currently, she is pursuing a PhD in the field of early childhood caries and was the only candidate from dentistry to have qualified for a PhD program from the Rajiv Gandhi University in the year 2019. With over 13 years of experience in teaching and in clinical practice, she has been associated with Narayana Dental Clinic, Access Dental Clinic, and the Kincha Dental Clinic. Currently, she practices at SN Dental Clinic and Implantology Center, Bangalore, along with her dentist husband, Dr. Srinivas Murthy. Dr. Gargi has presented several papers on preventive and pediatric dentistry at several conferences and has several publications to her credit. Dr. Gargi is active on the media in creating awareness about child dental care and has given several talks on popular channels on pediatric care. She is instrumental in conducting free dental screening and treatment camps throughout the year for the underprivileged children at her department at the Dayanand Sagar College of Dental Sciences. Dr. Gargi, thank you so much for joining me today in today's Two Talk conversation, and a warm welcome to you.
Thank you so much, Dr. Rekha, for that wonderful introduction. First of all, I would like to congratulate you on this successful initiative of educating the patients, and I'm really glad to be a part of that today.
Thank you. Thank you so much for joining me today. And I'm really very happy to have you with me so that you can share your experiences with all our parents and patients.
With pleasure, Dr. Rekha.
So I was just thinking probably dental pain is one of the most common causes of concern for any parent about their child. So in your experience, what you have seen, Dr. Gargi, what are the causes for a dental pain in a child?
Most of the times you see children in the dental clinic only when they complain of pain. So there are various reasons for which they come to the pediatric OPD. But the most common thing that we see is pain because of dental decay or the tooth decay, as we say. That is the number one reason why children get pain, like maybe cavities or a little beyond that also. That is number one cause. Then maybe because of tooth abscess related to dental caries again. Sometimes children have pain or discomfort while teething, which we call as the teething problem. And sometimes when the molars are erupting, the patient may experience pain. Also, you see pain when they have a trauma, there is fracture in the tooth, or they have got a restoration done, there's a faulty restoration, or the restoration is damaged. So these are also some of the reasons why they will be coming to the pediatric dental OPD. Sometimes we see ulcers in the mouth. Most commonly, we see the aphthous ulcers in children. So that is cumbersome for the child and the parent, and they will visit you. Sometimes there are also viral infections, like say primary herpetic gingival stomatitis, which we commonly see in very young children. It's a painful condition for which they visit us. Also, sometimes there is a fungal infection in the mouth, soreness, and these are some of the reasons for pain in children. But the most common thing I would say is dental caries.
Dental caries. So most of the time, 80% of the time, you would say is because of dental caries.
Yes, most of the times it is because of dental caries.
If I can ask maybe some very brief symptoms, or what is the kind of pain the child might complain of in each of these causes? The kind of
Yes.
discomfort the child may feel.
Yeah, yes. Yeah, it's very important to know the type of pain when the patient comes to visit you, because many times the pain may be associated with eating food or immediately after food. So this will only indicate that the cavity is very small. Say there is just initial dental caries or there's a cavity formation, which we can very easily settle with a restoration, or a filling that we call. We can do that and easily settle. Sometimes the patient may have severe pain, like it's intolerable. They have pain continuously throughout the night, and it's spontaneous. It's not associated only with eating or drinking. Spontaneously the child is complaining of pain, and there's a lot of discomfort for the child. These are cases where the cavity has extended into the soft tissue inside the tooth, which is the pulp, as we call it. So once the pulp gets affected, the patient has more severe pain. Sometimes the pain is severe in the night. When they lie down, the patient is not able to sleep. So when they approach you with this kind of pain, it means a filling will not settle the pain. We need to do something more, like say a root canal treatment or pulpectomy in children. These are the treatment plans you can think of that time. Suppose the patient just has some sensitivity, when they are taking some hot food, cold food. Sometimes it could be even brushing trauma. While brushing, they have removed a layer of enamel, so they have sensitivity. So these things may require a very small restoration with a very which is an easy procedure. Sometimes we may just prescribe some paste for them. So the kind of pain is very important before we rush into the treatment. So these are if they're having an abscess, the patient may have throbbing pain, like the pricking sensation. And surprisingly, sometimes the patient will be complaining of pain for few days and then they stop complaining totally. So even when there's no pain, it does not mean everything is fine with the child, because sometimes the pulpal degeneration or the soft tissues and the nerves inside the tooth would have degenerated to such an extent that the patient may not even have pain. So in children especially, having no pain also is of concern. So even if they have pain, a month back or 6 months back, if they were complaining of pain, it still means that there's something going on in the tooth which is not right. So these are some of the kinds of pain or the complaints that you can get in the dental clinic. Sometimes it may just be soreness, a kind of irritation in the gums, like when they're teething. It may not be frank pain sometimes, but it's just irritation, and the child wants to bite on everything, keep rubbing. So that is one of the treatment also. We tell them, we ask them to massage their gums with a fingertip, or I ask them to chew on some vegetables which will make them comfortable. So sometimes it may not be pain, it may just be an irritation or discomfort. Sometimes it may just be a burning sensation, like after when they're consuming food, the child may cry. An infant maybe because there's some burning sensation due to some fungal infection, or maybe ulcers will not let the child have his normal food. So in those cases, it may not be like shooting pain where the patient is crying of pain, but it may just be some discomfort, slight mild pain while eating. So these are the kinds of pain that you can see in the dental clinic for children.
Children. Okay. So, Dr. Gargi, you said that teething during when the child is getting his new tooth, he may have some discomfort. So, I think if I can just ask you for some clarification. Of course, there's a lot of myth around teething. That it's associated with temperature and with loose motion. Generally, I think mothers are very concerned. Is that coincidental, or is it true? Is it scientifically proven that the child may have other things associated?
Actually, it is not that with teething you will have diarrhea or fever, but it is a coincidence actually, and it's occurred so many times repeatedly that people have started associating teething with these things. Actually, the reason could be like that is the age the tooth starts erupting at 6 months of age, say 4 to 8 months. So the child has begun to get out of the lap a little bit, so he's putting many other things in the mouth as well. So this could lead to some sort of diarrhea, or maybe it's the beginning of infection. They are weaning away from the breast milk totally. They are introduced to other foods.
Food.
So the infection could be coming from these other sources, and teething is not the reason, but it occurs coincidentally so many times that yeah, most of the parents think that teething causes this. But
Causes.
scientifically, the cause of diarrhea or fever when the tooth is erupting is not this process of the eruption of tooth. It's
Okay.
just a coincidental finding.
Thank you so much for the clarification. So, and then you were talking about the other kinds of pain that the child can have. So, what are the kind of treatments we would be looking at, for the other kind of pains, like because of an ulcer or any viral infection?
Okay. See, when we talk of an ulcer, like an aphthous ulcer, see, most of these ulcers are going to settle on their own in a week or 10 days. So, the first thing is to reassure the parent that this is just a temporary phase, and whether I do something or not, this is going to eventually settle. But it's very important to give some palliative care for the child so he's comfortable, he or she is comfortable while eating, and the parents are also, not very worried about it. So, most of the times when it's, say, aphthous ulcer, or we will just be prescribing some topical application gels which can be applied just before eating food so that the child is comfortable to consume food. And once they do it for say a week, the child will be fine, the ulcer will go away. But in conditions, viral conditions like say herpetic gingival stomatitis, there is it's a more painful condition, and it will be associated with fever as well. So the patient has the prodrome of fever, and then you have this. So here also, again, like any viral condition, it's only palliative care. You will encourage the child to, you will ask the parent to give them a lot of liquids, and maybe symptomatically paracetamol if when required, and then you can again prescribe these mouth washes and gels to help the child consume his normal food. And then even this goes away in a matter of a week or 10 days. Sometimes measles is also a viral infection, which the patient gets rashes on the face and the hands and the extremities. But before even they get that, there can be spots in the buccal mucus, see, inside the cheek. So yeah, so inside the cheek there may be sand grains like lesions that appear, ulcers. So it can actually be an indication also that the child is going to land up with measles. Though you don't do much of therapeutic care for these children, it's only palliative care which will settle the condition. But if it is pericoronitis, or eruption of the back tooth, mostly it happens when your third molar is erupting. But you also see that in children, the first molar erupts at around, say, 6 years of age. So many times when it's half erupted, partially erupted, there is a flap of, the soft tissue, the gum that is covering. So the child, whenever he consumes food, there is accumulation of food there. So the pain increases. Sometimes there may be a small abscess. The patient is not able to chew. So in such conditions, we will, ask them to irrigate after eating, to clean that area neatly so that there's no food lodgement. Sometimes we have to even prescribe antibiotic and analgesics if there is any infection. If at all this is not going to settle it, sometimes we may have to remove that small portion of soft tissue that is covering the tooth. But most of the times, all that is required is to assure the patient that once the tooth erupts completely, all
Yes.
this temporary phase, it's just a temporary phase and it will go away. So till then they can irrigate and maintain. So other than dental caries, that is the filling or the root canal treatment or extraction, for these other conditions, generally these are the kind of treatments that we do or suggest, Dr.
Okay.
Rekha.
Okay. So, Dr. Gargi, what according to you would be the preventive measures? I mean, having a child contacting a viral infection probably is not in anybody's control. It can probably happen at any time. But things like probably a tooth decay is
Yes.
an avoidable condition. So, what do you think are the preventive measures parents can take?
See, prevention is always better than cure. There is no doubt about that. So, especially in a child, treatment is more cumbersome, painful, expensive, time taking. So, it's always better that you prevent, and to dental decay is totally preventable. We can do something about it. So the emphasis is on prevention for children, and that is the mainstay now, actually. So because what happens if at all the child is coming to you with dental caries, what we call as the early childhood caries in children less than 6 years of age, even if you keep restoring one or two teeth, the child again comes back to you with more decay in the other teeth. So unless you are targeting prevention, you will not be able to achieve what you want to, actually. So prevention is number one. So the number one thing for preventing dental caries is home hygiene. So what is important is to maintain good oral hygiene at home. So this is very easy, most inexpensive thing for the patient to do. What is important is brushing the teeth. So most of the times what happens, parents don't brush the teeth till all the teeth are erupted, till the child is 2 or 3 years, when it's more comfortable. It's totally understandable. But what is recommended is that when the at birth itself, soon after that, you're feeding the child, so you clean the gum pads. The teeth haven't erupted, but you take a wet piece of cloth or gauze and just clean the gum pads. But the minute the tooth starts erupting, say from 6 to 8 months, 4 to 8 months, anytime the lower incisor teeth can show up, so that is when you start brushing the teeth. So even with one tooth, you can take a small, soft, bristled brush and brush the teeth. And this is the most important thing. So as the child keeps growing, you shift to you'll have to brush at least twice a day for 2 minutes. Now, if you are thinking of brushing only once a day, the suggestion is to brush before bedtime, not early in the morning like most of us do. So we always like to brush when we get up in the morning, but don't bother much about the night. So I say, whenever you're thinking of brushing once, do it in the night and not in the morning. And when you're brushing twice, it is preferable that you brush after breakfast and before bedtime. And it's even advisable to brush after every meal. So brushing is one. Sometimes the children have very tight contact teeth. That is, there are no gaps between the teeth. In such cases, once the child is 3, 3.5, you can start flossing the teeth, because you see that most of the cavities in children will occur in between teeth. It begins, in the areas between the teeth. So once you are flossing, you are taking care of that, the preventing the dental caries. The next thing is the diet. So always give the child a balanced diet. It's good for the overall growth of the child, also prevents dental decay. So limit your snacks and give a balanced diet. The next thing is about fluorides. See, there is that is one armamentarium all of us have to prevent dental caries. So the easiest thing you can do at home is use a fluoridated toothpaste. Now, if the child, before 3 years of age, you can only smear a small layer of toothpaste. We actually call it the rice grain size. That much of fluoridated toothpaste is enough to brush the child's teeth and make sure you clear all the toothpaste. It's always important that you use fluoridated toothpaste. From 3 to 6 years, you can use a pea-sized toothpaste. Just that amount will suffice. And above that, say from 9 years onwards, the child can start using an adult brush itself. They can use an adult brush and brush the teeth, because by then you have a lot of permanent teeth that have already erupted. What is very, very important is when in younger children, the parents have to brush the teeth. The child does not have the manual dexterity to, completely thoroughly brush. So the parent has to do, and up to 7 to 8 years, they have to supervise. So even though the child is brushing, the parent has to stand next to them, make sure they're using the fluoridated toothpaste twice a day, brushing a minimum of 2 minutes. So 2 to 3 minutes they have to brush their teeth, and help them with that. The next thing is when they take them to the dentist. See, that can't be overemphasized. The first visit should be at when the first tooth erupts, that is at 6 months, but not later than 1 year of age. So before their first birthday, make sure you take them to the dentist. Then you can avoid a lot of problems. So the dentist will either prescribe, some fluoride supplements if the child requires it. Otherwise, they may apply, fluoride, topical fluorides, or these fluoride paints or gels on the teeth to prevent dental caries. So this is very important to prevent dental caries. The next thing is when you take them to the dentist will also look at the molars, the areas where food gets retained and causes dental caries. So these areas they are going to seal it with so a resin material so that the food doesn't get stuck there and lead to dental caries. So these are some of the preventive measures that all parents can use to prevent dental decay. Once they prevent dental decay, the main source of pain is automatically cut.
I know, I know. That was very interesting and very informative talk, Dr. Gargi. And I should thank you so much for joining me today and sharing your knowledge and experience with our patients today about how what tooth pain is and how you can take preventive measures to avoid a tooth pain in your child.
Thank you so very much for inviting me over today, Dr. Rika. It's been a pleasure.
Thank you, Dr. Gang. And I hope I can get you back to do more talks so that it will help our patients.
Oh, definitely, definitely. I'll be glad to. Thank you.
Thank you.
Thank you.
Viewers, that was Dr. Gargi S Murthy, who did talk to us about the causes of tooth pain in your child or dental pain in your child and how it can be treated, or even better, how it can be prevented in your child. I hope that talk was helpful. If you have any doubts or queries, please don't hesitate to write to us and we will get back to you on that. So until next time that I come back with another dentist with another topic to discuss with you about your oral and dental health, keep smiling, stay safe, and be happy. Thank you.